let's turn our attention to the female hormone testosterone gap in postmenopausal women who take female hormone replacement. As I explained in detail in video 5, the brain of a postmenopausal human female is having a violent reaction to the failure of her ovaries. Her brain has directed her pituitary gland to stimulate her failing ovaries as much as is biologically possible. This is basic physiology. As a result, these ovaries still do produce some estrogen, some progesterone, and some testosterone, but certainly not enough to be vigorous, energetic, and sexual. In other words, not enough to be healthy. Now the woman decides to go on female hormone replacement. She begins taking a pill or a patch with estrogen and progesterone. What happens? Her brain and pituitary, sensing renewed adequate levels of these two hormones, stop driving her ovaries so hard, and her testosterone levels fall to essentially nothing, leaving an enormous gap between her female hormone levels and her testosterone level. The second National Institute of Health study duplicated this situation. Female monkeys, postmenopausal because they were without ovaries, were treated with either estrogen and progesterone or with estrogen, progesterone, and testosterone. What did they find? Quote, "We show that addition of a small physiologic dose of testosterone to standard estrogen therapy almost completely attenuates estrogen-induced increases in breast cell activity, suggesting that the increased breast cancer risk associated with estrogen treatment could be reduced by testosterone supplementation." And quote, "These findings suggest that treatment with a balanced formulation including all ovarian hormones may prevent or reduce estrogenic cancer risk in the treatment of girls and women with ovarian failure." Close quote. A more recent study, this one done on human breasts, also duplicated the female hormone replacement situation. It was done at the Karolinska University Hospital in Stockholm, Sweden, and was published in April 2007. The study report began with the following, quote, "During the past few years, serious concern has been raised about the safety of combined estrogen-progesterone hormone therapy, in particular about its effects on the breast. Several observations suggest that testosterone may counteract the stimulating effects of estrogen and progesterone in the mammary gland." Close quote. In their study, they first biopsied women's breasts to establish a baseline of cellular activity. Then they did the same as the National Institute of Health had done. They gave one group of women estrogen and progesterone, and the other group estrogen, progesterone, and testosterone. After 6 months, repeat breast biopsies showed that the breasts of the women who received only the female hormones were highly stimulated, but there was no change at all in the breast tissue of the women who had also received testosterone. Quote, "In the group not given testosterone, there was a more than 5-fold increase in total breast cell activity from baseline. During testosterone addition, no significant increase was recorded." Close quote. So far, we've seen that 2 of the greatest known risks for women to get breast cancer are associated with the exact opposite changes in their female hormone levels. So how can female hormones possibly be a primary factor? On the other hand, not only are age and female hormone replacement both associated with a widening gap between female hormone levels and testosterone, but 3 biopsy studies have shown that the female hormone testosterone gap is highly irritating to breast tissue. How do these findings fit in with other recognized risk factors for breast cancer besides age and female hormone replacement? A younger age of onset of the menstrual cycle identifies women at greater risk of getting breast cancer. These women very well might do everything at a younger age, including losing their testosterone. An older age of menopause also slightly increases the risk of breast cancer. Logically, it should, they're having a prolonged higher quantities of estrogen and progesterone in the face of falling testosterone levels. The Mayo Clinic website states that use of birth control pills is associated with an increased risk of breast cancer in premenopausal women. A significant decrease in testosterone is an inescapable consequence of taking birth control pills. If testosterone levels didn't fall, the pills wouldn't be working. There are also what are called modifiable risk factors for getting breast cancer. These include being overweight, being inactive, and excessive alcohol consumption. I believe the association of breast cancer with being overweight exists, but I find it hard to imagine a woman not getting breast cancer simply because she loses 20 or 30 pounds. It seems kind of silly. In regard to exercise, one study reportedly found that just a couple of hours of brisk walking a week reduced the risk of breast cancer by 18%. Does anyone really believe that a 2-hour walk once a week will prevent a woman from getting breast cancer? The association of obesity and inactivity with breast cancer exists because they all have the same underlying cause, testosterone deficiency. In video 12, I explained that among the most common early symptoms of testosterone deficiency are increasing abdominal fat, lack of energy, and lethargy. So obviously these two findings would frequently accompany breast cancer. In addition, because testosterone deficiency also promotes depression, anxiety, loss of sexuality, and a poor sense of self-esteem, I strongly suspect that the hormone deficiency is often an important underlying contributor to alcoholism. There'll be more on this in a future video. When it comes to the relationship between the hormones produced by the ovaries and the risk of breast cancer, the so-called female hormones, estrogen and progesterone, get essentially all the attention, despite the fact that when it comes to getting breast cancer, it makes little difference whether a woman still has younger, adequate levels of these two hormones or has been losing them for decades. To make any connection even less plausible, after the menopause, the risk of getting breast cancer increases whether the levels of estrogen and progesterone go up or go down. In stark contrast, not only is breast cancer uncommon or even rare in women who have adequate quantities of the third ovarian hormone, testosterone, but the more of this hormone that is lost during a woman's life, the greater her risk of getting breast cancer. Every circumstance known or widely believed to promote breast cancer, with the possible exception of genetics, points a huge flashing arrow at testosterone deficiency. And on top of this, 3 studies have proven by breast biopsies that the absence of testosterone is highly irritating to breast tissue. What more do we need to focus in on this connection? How long are we going to let women continue to get yet another horrible disease and suffer and die because of the closed minds of the medical establishment? My next video is also going to be about breast cancer, but this time about the belief held by some in the medical community who have the exact opposite opinion, that replacing testosterone increases the risk of breast cancer. Wow. Watch it, so that if you ever hear such an opinion, you'll know the facts. As always, I ask that you help me spread the word about the existence of this disease and the existence of these videos, so everyone has the opportunity to make an informed decision about their testosterone health. I'm Dr. E. Barry Gordon. Thank you for watching.